Welcome to another edition of Zoost, and today we're looking at the treatment of the horse under mild sedation. And this is for a horse that's had longer term problems. He's an older chap, does dressage occasionally, and in his lifetime he's done a lot of work. Now what the sedation does is it just switches off some of the fight-flight mechanism that horses have. Because traditionally they're a prey animal, and when things worry them, they either defend themselves or run away. And when we're treating them, especially for conditions affecting their body framework, it can occasionally trigger that fight-flight mechanism. And with the longer standing movement issues that some of these horses get, these performance horses, it's important to be able to treat them without causing them distress. Now you'll see his blinking of his eyes changes as I'm doing this. I'm not forcing this, I'm allowing him to relax and stretch out and use my shoulder and arm as a resting post for the rather large head that horses have held out on the end of that armature, which is their neck. And for us, our head sits on top of our neck, but for horses and dogs and other quadrupeds, the neck obviously has to be supported, sticking out of the front of the animal. And then I'm working all the way through the musculature and the fascia and the skin and all the connective tissue. And here I'm just seeing if he wants to take a stretch. Very often the horses find this a little bit confusing, so they'll look round, but you can see he's not bothered, but he's altering his centre of gravity and also his orientation, so you'll see him moving from left to right just a little bit. And then we sometimes get the owners just a proper front leg, just to really ensure that they don't fold their front legs and startle themselves. Now where I'm just wriggling my fingers there, he's releasing some of the musculature in his what are called his gluteal muscles. And when a horse is moving correctly, the big bottom or gluteal muscles are the engine house of the horse, so they're really where the propulsion should come from, and they should use their front legs to sort of stretch out and almost pogo or pole vault the body over the front limbs, whilst they gather up the hind limbs, bring those forward underneath them, and then connect with the ground, and then the gluteal muscles and the other leg muscles should engage, and they should then push themselves forward. So that's when a horse is moving correctly. And what we're trying to do is just maintain this horse. He's an older chap. He's not old, but he's in his late teens, I think. Might even be nearly 20. And that's nowadays in the sports horse classed as a veteran horse. Obviously they can live a lot longer than this, and hopefully he will go on for many more years. Now you'll see when I go back onto his neck now, I'm actually crouching down more, and that's because he has already started releasing tension throughout the entire length of his body, and he's just really stretching out now. And I'm not holding the back of his neck at all, as you can see. And as he releases there, he just gives it a good shake. But I wasn't restraining him. I wasn't stopping him from being able to do that. And then I'm just checking. You see me wiggling his head and now his neck. I'm just seeing what the ease of movement and the resting state of those soft tissues are now like. And he doesn't want to stretch at the moment, so I'm just gently pushing him forward so that I can lean back, and then he can take a stronger stretch forward, and it's him pulling away from me rather than me trying to pull him backwards. It sounds like we're splitting hairs, but it's important that the horse is allowed to stretch and release the muscle groups and areas of tension that it needs to, rather than me dictating which ones it does. And you'll just see him swaying ever so slightly from left to right. That is not me making him do that. That's him choosing to do this. And I should note that this is all taking place in a veterinary surgery, and the vets have performed the intravenous sedation, and all the horses are referred to me via the vets, via their owners' vets. And this is one of the many regular clinics that we operate at Zoost. And before I forget, please, if you haven't subscribed to the channel yet, hit the subscribe button below this video, and please do hit the little bell icon as well, and that will tell you when I next post up another interesting video, or just another video. But we do appreciate the support we're getting. The channel will only grow if we get support, and we want to really get osteopathy better understood. Because as you can see here, we're not forcing anything with this patient.